Welcome to OET Speaking and Writing. Read and prepare task for 2 minutes. Good morning. My name is Sarah, registered nurse working in this community health center. How can I address? How can I help you today? Probably patient may tell like, I have received a letter from your side to have a vaccine. I can't exactly remember the name of the vaccine. Then we can tell like, well, do you have the letter with you? Oh, now I remember, we have sent a letter to you since you have rheumatoid arthritis. Then patient may express his concern about vaccination. In that situation we need to reassure him. You can tell like, I completely understand your concern about this vaccination, but let me reassure you that there is nothing to be overly concerned because it's safe and you will be absolutely fine by taking this vaccination. In my experience, I have seen a lot of people who is having rheumatoid arthritis and after taking this vaccine they are absolutely fine. If you don't mind, can I explain why you need this vaccination? Then you are to explain the importance of vaccination. You can tell like, Mr. John, the vaccine which is recommended for you is called pneumococcal polysaccharide vaccination. The primary reason for advising this vaccine is because of your rheumatoid arthritis. These patients are more prone to get pneumococcal infections such as pneumonia, blood infection due to compromised immune systems. Are you following me? Probably the patient may tell you like, but nurse, I always take the yearly flu vaccine and it would be enough for the protection. Then we can tell like, I understand your perspective. Let me tell you that these are two different vaccine. I will explain the difference. PPV is bacterial vaccine and it is only given on every 3 years. Flu vaccine is viral. And it is administered on yearly basis for protection. In flu vaccine, the strain changes constantly unlike in PPV. Is that clear to you? If the patient asks about side effects after receiving the vaccine, we can tell him like, there is a possibility of temporary mild side effects, like mild swelling or redness at the injection site and mild temperature. But these are temporary. It will go away by itself. If they are persisting, or if you feel unwell, I suggest you to make an appointment with your general practitioner. Sometimes the patient may ask about the duration of 2 different vaccination because he had annual flu shot 2 weeks back. Then, we can tell like, it is understandable to feel worried about vaccination. Could you tell me your experience after taking flu shots? Or you can ask have you had any reaction after flu shots? If he was comfortable after his previous vaccination, we can tell him like alright Mr. John, there is nothing to be alarmed about taking vaccine today. There won't be any adverse reaction. Along with that 2 weeks interval is good enough. I assure you that, if you take the vaccination you will be completely free from pneumococcal infections, so that you can lead a healthy life. Am I clear to you? Probably patient may agree with you. Then you can tell like, I am glad with your decision. Do you have any more concerns regarding vaccination? If no concerns, we can tell like, I am going to nursing station, to prepare your injection and I will be back soon. If you need any further clarity, here is a booklet, which contains detailed information about his vaccinations. Thank you Mr. John. In this way you can end up your